Hello and welcome to HDtv Health District Television, brought to you by the Southern Nevada Health District. I'm Brian Gresh. Before the break, I hinted at this special report by Stephanie Bethel, the last in our series celebrating the Southern Nevada Health District's 50th anniversary. Stephanie, we looked at the district's history, the chief health officers, and environmental health during the last 50 years. What's left?
Well, it's more like who's left, Brian. Specifically, the public health nurses. They're often the face of the health district in the community, and as I think you'll see, it's a long and proud tradition. As a matter of fact, one of the nurses in this report actually predates the health district itself. Evelyn McCall began working for the then Clark County Health Department in 1957 as a public health nurse under Chief Health Officer Dr. Decatur Carr, one of only 2 such nurses for all of Clark County.
You get involved in neighborhoods. Just as an example, the Moab Indian Reservation, which is up outside of Overton, well, the county was divided in 2 because there were 2 public health nurses. So she had one half and I had the other. And once I learned how to get into the community, which is leaping across the river, you become part of that whole community. When the other nurse and I left to join the Navy, that meant that there were no nurses at the health district. However, I'm sure they hired a couple, because when I came back after my stint in the Navy, there were 3 or 4. In the meantime, Dr. Carr was getting older, and many of the things that he was doing were old-fashioned. And of course, I was this young, eager nurse out of school, and I didn't like standing there filing needles to get them pointed and boiling things in the sterilizers for the shots. But he was good. He was startled about some things we did, but he allowed us to do them. And that's when you just get so enthused of what you can do in something you love like that, and we did. So I did go back to school, and I came back, and then I became the supervisor.
Having, by her own admission, worn out a couple of chief health officers, Evelyn became part of the newly formed Clark County Health District, led by Dr. Ravenholt in 1963.
Communicable disease was a big issue, and but we also saw in the homes many health issues that there were no, quote, public health programs for. Because if you saw someone that needed care, there weren't in those days any instructions how to do it. So that was the impetus for us wanting to start an in-home health service. And the second health officer I had was kind of for it. Then we had a couple interim health officers, and they just weren't there enough to give me much backup. But when Dr. Ravenholt came, he was enthused too about doing more, and so we started a home health service, in-home health service. And so Dr. Ravenholt allowed us to pursue that and develop a program for in-home hospice. At the same time, you might suspect, the issues of AIDS and drug addiction, so many other things were coming about. And fortunately, Dr. Ravenholt had enough trust in us, both of us, in our deputy health officers, that he made us deputies. He took us from being directors to deputies so that we could manage the needs that were needed. And that's when we started a methadone maintenance program. We had an AIDS program, and we had a family planning program, and Doctor allowed us to send some of our nursing staff to school to get advanced practitioner certificates so that we could offer clinics nurse managed under a medical director's supervision.
Evelyn's career with the health district continued until her retirement in 1990, although she still volunteers at a local veterans clinic. And although there isn't time to hit on all of her accomplishments and the growth of the district's programs, what's most important to note is her spirit, her enthusiasm, and her passion to make the community healthier. It's a theme of independence, initiative, and service which seems common to most public health nurses.
You know, for the first 6 months of my career, I did some hospital nursing, and that just wasn't my cup of tea. I preferred the community venue and the education and the outreach and trying to do something that really impacts the health of a community, and I found that niche in public health.
I was always attracted to public health. I came from a program out of Loyola University in Chicago, and this was a baccalaureate program when baccalaureate programs were kind of cutting edge. And in our 4-year program, we had like 2 semesters of public health, studying public health and then doing public health nursing. And it was always it was always fascinating. I enjoyed it because it was multifaceted. It wasn't boring. It was kind of like something new every day.
My father was actually an undocumented immigrant from Mexico. He was orphaned at 4, brought over the border back in the early 1920s by his 15-year-old sister, was raised by her and her much older husband, a very intelligent man. He had a physical disability, was mentored by one of his grade school teachers. He became actually a physician, fought in World War II. After World War II, obtained his citizenship, again became a prominent physician in the community in which we grew up. He never forgot where he came from. He always believed in giving back to his community. I was raised with that thought. In addition to that, I like the challenges of public health nursing. You function independently. You have to do a lot of critical thinking. So I've always enjoyed it. And again, I believe in giving back to my community as my father raised me to do.
I know that being in public health is very different than being in a controlled area such as a doctor's office or a medical clinic or a hospital. Public health nurses are out there. We're out there pounding the streets, we're knocking on doors, we're in people's homes.
I was hooked. It took me 3 tries, in fact, to be here. Okay, I quit 3 times and kept coming back to public health. I did moms and babies, and I was a brand new mom at the time, and I was hooked to the health of the community and to the health of brand new babies.
Their passion is evident, but it's also true that they're unsung heroes. If they and the public health system are succeeding, it's typical for their work and dedication to go unnoticed.
We're sometimes the very best kept secret there is, and you know, we often provide services to the community that people want kept confidential. And I think we pride ourselves on respecting that confidentiality for all of our clients, and that's the beauty of our program. And people aren't normally going to go to a cocktail party and talk about the services they got from a public health department, and that's fine. That's fine. But you know, we are doing our job, and if things are quiet in the community, public health is always there functioning.
Public health is very challenging, and you have to be very patient in public health because your results are not seen right off the bat. So I know that that the public health people are doing a good job. Even though our immunization rates are low, what makes me feel good when I wake up in the morning is we didn't have an outbreak yesterday. We have healthy kids, so we must be doing something of a good to the community out there.
A lot of us right now, because we see the graying of nursing in general and public health workers in particular. I think that a lot of us are looking towards the younger ones and trying to give them some help and some insight. And being in public health now for almost 30 years, this is the best type of nursing. It has been for me. I've had a lot of personal contact, a lot of helping people who are ill, but a lot of education and trying to prevent those illnesses. And I think that's the way we're going to go, the future for medicine in general in this country.
When the nurse is in the home, she's treating that family really, and she's teaching that family. And if you don't teach, and that's to me public health. Public health is teaching. Families are just, if you're open to them, they are so open to you. And I know people fear immunizations and things nowadays, but you know, they need to have someone talk to them like they would their family member, not a professional. Well, you need these shots because this is the statistics, you know. You need to talk to them like they were your sister or your brother, you know. Not everybody's going to do public health because you have to be pretty darn independent and pretty sure of yourself.
And Brian, that's just a glimpse of who these dynamic and caring nurses are.
Independent and sure of themselves. Quite a legacy.
And a living one. The technology and challenges may change, but today's young nurses are as committed as ever.